Hello, dear doctors, nurses, medical students, and healthcare team. How are you today? I hope you are well. Here we are going to talk about another question about cardiology. A 56-year-old man presents to the emergency department with chest pain. The following ECG was taken. This is the patient's ECG. What's the single most likely diagnosis? A. Anteroseptal myocardial infarction. B. Inferior myocardial infarction. C. Lateral myocardial infarction. D. Posterior myocardial infarction. E. Non-ST elevation myocardial infarction. As we can see in this ECG, the patient has the ECG shows ST elevations in lead V2, V3 and V4, and this is pathognomic, which are this V2, V3, V4, which are anterior, and V1 we can see also is septal is showing septal and anterior leads. We can say that the patient has anteroseptal myocardial infarction, and here we are going to explain a little more about anteroseptal myocardial infarction. Okay, explanation. There is ST elevation in leads V2, V3 and V4. As we said, we can see ST elevations in lead V2, V3 and V4. This ECG shows a classical example of an anterior myocardial infarction. Okay, more ECG details for anteroseptal MI. Q waves are present in the septal leads, which are V1 to V2. As we can see here in lead V1 and V2, we can see prominent Q waves. Also in V3, we can see also prominent Q wave. Note the septal ST elevation in leads 1 AVL and lead V5. As we can see here, septal ST elevations in lead V1. We have it here in this V1, AVL, in lead AVL and lead V5. As we can see in this ECG clearly. With reciprocal ST depression in lead 3. Also we have reciprocal ST depression in lead 3, which we can see in this ECG. Okay, there are hyperacute or peaked T waves in leads V2, V3 and V4. As we can see, if the anteroseptal MI is a little progressed, we can see peaked T waves in leads V2, V3 and V4. Here we are going to talk about ECG change in myocardial infarction and coronary artery which is involved. Okay, if the MI is anteroseptal, we will see change in leads V1 to V4 as we said here. And in this picture we can see also V1, V2, V3, V4, which are septal and anterior leads. And when we can see the change in these leads, we can say that the patient has anteroseptal myocardial infarction, and the involved artery would be left anterior descending artery, and the involved artery would be left anterior descending artery, which we can see in this photo. Okay, but if the patient has inferior MI, we must look for changes at leads 2, 3 and AVF. As we can see, leads 2, 3 and AVF are showing inferior aspect of the heart. If the patient had MI, we must look the change in lead 2, 3 and AVF, and the involved artery is right coronary artery in inferior MI. As we can see, the right coronary artery is supplying the inferior part of the heart, and it is involved in inferior MI. But if the patient has anterolateral MI, we can see ECG change in lead 1 AVL and V4 to V6, as we can see here. In anterolateral MI, we must look at lateral and anterior leads, which are lateral leads are lead 1 AVL and V5 to V6. We must look in anterior leads also, which is V3 and V4. In anterolateral MI, we can see ECG change in lead 1 AVL, V4 to V6, which we can see in this photo. Okay, and the involved artery would be left anterior descending or left circumflex, as we can see, left anterior descending or left circumflex artery. They are supplying anterior and lateral aspect of the heart. If they are involved, we can see anterolateral MI. In posterior MI, we can see tall arrows in lead V1, V2. V1, V2, they are showing in the posterior aspect. We can see the posterior aspect of ECG looking at V1 and V2, and we can evaluate it. If we can see tall arrows in lead V1, V2, it shows that the patient has posterior MI. Also note the reciprocal ST segment depression in the anterior chest leads. Also we can see reciprocal ST depression in V3 and V4, and the involved coronary artery is usually left circumflex, and also right coronary artery, which are going to supply the posterior aspect of the heart. And here we have some photos which are showing normal ECGs and different types of anterior septal and inferior leads, different types of cardiac leads. It's explaining it, and different coronary arteries which are supplying the heart, and in MI which one of them is involved.